mentioned, I am a PhD student at MIT, and I study models that estimate causal effect from observational data where the treatment assignment is not at random. Like, for example, a physician is trying to understand what is the causal effect of me putting my patient on chemotherapy. What we usually do in the machine learning community is we try to go for the most accurate estimate possible. And like the cartoon suggests, this is not always very useful. It's often an overkill. So it's not particularly useful for the physician to know, oh, my patient's life is going to increase by 4 years, 6 months, 11 days, and 2 hours, and a couple of seconds. It's usually just sufficient for good decision making for the physician to know, oh, well, my patient's life expectancy will increase by 4 to 5 years. And that's exactly the kind of questions that we're trying to answer here. We're trying to learn models that enable us to make statements like the one that you see on the slide. So if the patient is treated, her life expectancy will be 80 to 85 years. If she is not treated, it will be somewhere between 70 to 75 years. And for this tool to be something that's useful for decision making, we want the false coverage rate to be low, or in a lot of cases we just want it to be 0. And we say that an outcome is falsely covered if the upper bound that we estimate is lower than the true outcome, or the lower bound is higher than the true outcome. And what we found out is that if all we need are upper and lower bounds of our causal estimates, this is actually an easier task to learn from a statistical learning theory perspective. And the intuition behind our theorem is highlighted in this plot. So the black and gray lines is the true potential outcome, is the true outcome that we're trying to estimate, and it belongs to a complex function class. It's very wiggly, right? But the red and blue lines, these are the bounds, and they give a false coverage rate of 0, so they're really good. But they actually belong to a very simple linear function class. Now, I'm going to very quickly flash our, like a simplified version of our theorem. Don't get scared, just stick with me. So what this is saying is basically that the risk of overestimation depends on this k term. And what you'll notice is that this k term takes as a function gamma. Gamma is related to the confidence with which we want our bounds to correctly cover the data. And the two terms that you want to look at are the two ones that are highlighted. The first one is the complexity, the statistical complexity of the function class that we're looking at, and the second one is the empirical error on the training set. Both depend on gamma, and both decrease as gamma increases. If I've lost you for the last 5 seconds, all I've said is if I want a low false coverage rate with high confidence, then the task is actually easier. Now, the problem that I've described so far is a little bit ill-defined, because if you look at all these 3 plots, they all achieve a false coverage rate of 0. But let me ask you this, which one do you think is better? Raise your hand if you think A is the best one, best fits. Good. How about B? Some people. All right, how about C? Great, good. The fun thing is that you all answered the right question. And this is because the question was a bit of a tricky question. Different bounds or different estimates of bounds will be useful in different situations. So the plot C shows the bounds that are tightest on average. So if the physician wants to make sure that on average I am estimating the tightest possible bounds, then plot C shows the best fits. But if the physician wants to make sure that the worst case scenario is never too bad, meaning the widest intervals are never too wide, then the second plot is actually the best plot. The first plot doesn't look like it's doing anything efficient, though I'm sure you can think of a possible like utility for it. And to account for this difference in possible uses, we flexibly models, or we propose a model that flexibly allows physicians or decision makers to plug in their own utility functions. So in plot B, we were minimizing the maximum interval width. In plot C, we were minimizing the average interval width. Because I've exceeded my math quota, I can't put any more details here, but feel free to ask me about more details at the poster. We tested our model against a bunch of benchmarks, and what this plot shows is the majority of benchmarks actually violate the required false coverage rate, which is denoted by the dashed line. Only our model and one other benchmark are able to achieve the correct false coverage rate, and our model gives a tighter mean interval width compared to the other benchmark. And here we were optimizing for tightest possible mean interval width. In fact, our model does better than that one benchmark that does not violate the false coverage rate at every possible FCR, every possible false coverage rate, which shows that our model is better able to exploit this trade-off that I showed you in the one scary slide. So in summary, we showed that there's a trade-off between the confidence with which we want our bounds to hold and the complexity of the learning task, and our algorithm does better than benchmark, and it's able to exploit that trade-off a little bit better. Thanks for listening, and please stop by the poster later.